to another episode of Tot Talks and our live talks about all things pediatrics. So I think this is my fourth episode of Tot Talks. I'm Dr. Jean Wagner, and I'm with A to Z Pediatrics, which is in Caseyville, Illinois. And I work with two amazing pediatricians, Dr. Mark McGranahan and Dr. Lori Eberhardt. And hi, Lydia. Tell Lydia I said hi, Erica. We have four awesome nurse practitioners as well, Melissa and Joe and Andrea and Claire. And so I decided to do these, gosh, it was probably 2 years ago, but I just really couldn't get myself motivated to do them. And I tried and I sounded so stilted. And so it was actually my nurse who suggested that I kind of do them like live and off the cuff, and it worked out a lot better. So, oh, Abby, tell Reagan and Gabby that I said hi. That's awesome. So today my topic is going to be more geared towards parents of newborns, but I think that most of you have had friends who have gone through this, or you yourself might have gone through this. And I just think it's something that we need to talk about. It certainly bleeds a little bit into postpartum depression. Yes, Katie, Ava is definitely a fussy baby. I'm so sorry that she's fussy. It's terrible, but this topic I think bleeds into postpartum depression, which is something that we as women really need to talk more about, that it sort of gets shoved under the carpet and we don't really get that topic out there enough, that we're supposed to, as women, just sort of suffer through this first 6 to 8 to 12 weeks of our baby's lives. And it's supposed to be so perfect, and it's supposed to be so joyous and amazing. And it totally is. However, sometimes it's not. And sometimes it's really hard. And sometimes you just really wish that you were not there. And so it can be really hard on a mom and a dad too, that you have these moments of regret, and you have these moments of wishing that you didn't have the baby, and you have these moments of just feeling like you're overwhelmed and exhausted. And so even though really this is definitely about fussy babies, it's also about scared, tired mommies and daddies who need support and love and backup. So I think that's why I like to talk about it. Also because my babies were rotten, horrible, no good, terrible infants. And I was a horrible, rotten, no good, terrible infant. So I think that it definitely runs in my family to have fussy, colicky infants. And I think that's why I only had 2 kids, because I was pretty sure that God was going to give me another one, and I could never, ever do it again after 2. So I spent like days and days and days and nights and nights and nights walking and rocking and walking and rocking and not getting any sleep. So I know a lot about having colicky kids. And I can tell you that the one thing I will tell you is colicky babies turn into like the most amazing toddlers who are so sweet and funny and precocious, because I don't know, maybe just because they get so much attention when they're newborns. I'm not even really sure. So I think it looks like we're probably about 5 or 6 after. So I'm going to go ahead and get started. And we're going to have a little special guest appearance today by my friend. This is Scout. And he's been in our house for a long, long time. He's a cheetah, or I don't even know, maybe he's a jaguar. Anyway, he's my daughter's, and he is going to be doing, he's going to do some demonstrations for us today. So this is Scout. Everybody say hi. So anyway, let's start with newborns. And just going to tell you, all babies are fussy and all babies cry. That's just the way it is. They all cry and they're all fussy. Most normal babies cry for a reason. They're tired, they're hungry, they're wet, they're cold, they're hot, they're bored. They just want to be held. And so most of us as moms kind of figure out normal ways to soothe our kids, rocking, singing, swaying, shushing, swaddling. They want to be changed. We feed them. And usually by the time they're about, I don't know, 4 to 6 weeks or so, most of us can kind of figure out that there's different cries that our kids have for different things that they need. And so then it gets a little bit easier. But the first 4 weeks are super, super rough because they just cry a lot. And most of the time you just kind of can't figure out why. And it just seems like you're trying everything and nothing seems to make them happy. So it's a lot of just trial and error until you and your baby sort of get to know each other. But normal baby crying should be temporary, meaning that eventually you sort of figure out what's wrong. Normal baby crying shouldn't last more than 10, 15, 20, 30 minutes at the most until you figure out what it is they're trying to tell you. That, like I said, they're hot or they're hungry or they're bored. And then once you sort of figure that out, they calm down, you feed them or you change them, they get themselves settled. And then, however long it takes for whatever their next problem is that needs to be fixed, you fix that and then they calm down. And so it's kind of a cycle. And most newborns, in the first 6 to 8 weeks will kind of go through a cycle of they sleep, they wake up, they cry, you feed them, they poop, they cry, you change them, you change them, they're happy again for a little while, they cry, they're hungry, they sleep, and then it just kind of goes all over again. And yes, Allie, that is absolutely the truth. Allie just said the first 4 weeks, they're just little fussy potatoes. And that is, oh my God, that's absolutely the truth. They are nothing but like little fussy potatoes because they do nothing except cry and eat and sleep and poop. They don't smile, they don't give you much feedback, and you're so tired, and you're just so tired. So sorry, I'm fixing a text message. Okay, so that's kind of normal. That's what normal babies do. Some babies are worse than that though. And that's really where we get into some kind of more trouble, right? Moms who are overwhelmed and exhausted. You get your gassy babies. Gassy babies are normal. All babies have some gas, right? I mean, gas is part of digestion. So when babies are born, they don't really have the ability yet to digest their food. So it produces a lot of extra air. They also gulp when they eat. They're not really quite, real good at like the suck, swallow, breathe process. So they gulp air when they eat. When they cry, they gulp air. So there's a lot of air going down through the digestive tract and down into their colon. And so it's got to come out one way or the other, this way or that way. So all babies have gas. All babies have to pass gas. It does not necessarily cause as much pain as I think most of us parents think that it does. There's a lot of things you can do to soothe them when they seem to be gassy, meaning that they're kind of grunting and pulling up their little legs and, tooting a little bit. You can kind of bicycle their legs and put a little heat on their tummy. I'm definitely going to go through this in a lot more detail in a minute, but I think it's important to know that all babies are gassy. Every mom thinks that their baby is the most gassy baby in the whole universe, but all babies pass gas, and it is totally, totally normal to pass gas. Up until about 4 weeks, that kind of gassy sort of appearance or worry that a parent will have will get worse and worse and worse and worse. And by about 4 weeks, it gets about as bad as it's going to get. And then usually after 4 weeks, it starts to get better and better and better and better. And by the time they're about 2 months, most parents will report that they don't seem as gassy, they don't seem as fussy, they don't seem as kind of irritable. And you start to kind of be able to figure out like when they need what they need, and you can start to speak their language a little bit more. They understand you, you understand them. And that's in sort of your typical normal baby who doesn't have colic and doesn't have formula intolerance and doesn't have digestion problems and isn't premature and things like that. So you're just like your normal typical baby. So by about 2 months, that sort of, you can't really figure out what's wrong with them problem should be resolved. If it's not, you should definitely let your pediatrician know. So what are some things that you can do to prevent your baby from being gassy in the first place? So first thing is to make sure that you burp them. Now, parents put a lot of stock into how important getting a burp is. It's not so much that you get the burp, it's that you just need to let them try to burp. So when they're feeding, maybe at the beginning every ounce or so, and then as they get bigger, maybe, just at the end of a bottle, you just want to, I'm going to use Scout. Come on, Scout. Okay, so, you got them like this and they're eating, right? And so they've got their little esophagus in here, you just kind of want to tilt them upright so that the air can go up and the liquid can go down. So you can hold them this way, you know, up on your knee like this and support their head and sort of tap that air up and out. You can hold them up this way and tap it out this way. But the whole idea is that you are just sort of like tapping that glass to let the bubbles rise to the top. You might never hear the burp, and that's okay. That's okay. Don't make them so mad by just tapping and tapping and tapping and tapping and waiting and waiting and waiting that now that you've completely irritated them and now they're crying and screaming because you've made them wait so long for that next ounce that you're going to give them. Instead, remember that it's just an opportunity for the bubbles to rise to the top and blurp out the top. So maybe every ounce, maybe every 2 ounces, depending on how fast your kid eats and how big they are and how old they are. The older they get, the longer you can wait. And it's really just, like I said, giving them a chance to tap those little bubbles to the top so they can come right out. This is so cute. And so that's kind of, you know, the burping to help keep the gas from going down, you know, so that they don't swallow the gas. You know, choosing a bottle that works for them so that they're not gulping air while they're eating, keeping a good seal in their mouth so they're not gulping air while they're eating, and sort of feeding them semi-upright and keeping control of the bottle. That's part of the reason why we don't recommend like laying them down and propping the bottle up with like a folded towel, because then what happens is they don't have the ability yet to stop the flow of the liquid with like their tongue or their mouth. So like they just can't stop and the liquid is flowing in and they're trying to stop it and they can't. And so you kind of, if you see them start to kind of cough or sputter or stop swallowing, you can pull it out and that can help prevent a lot of overfeeding and gas bubbles and stuff. So you keeping control of the bottle and burping often can prevent the gas from going in. Once they've kind of already moved into that, I already got gas, it's down there, there's nothing you can do to get it out now, then you got to move more into like, well, how do I fix it? Heat is great because it kind of like relaxes their tummies. So a little heat on their belly, sort of bicycling their legs. So laying them on their backs, you know, you're not going to be able to see him, but laying them on their backs and sort of taking their little legs and gently bicycling their legs up and down. So that's, or you can kind of push them back and forth this way, real gentle. And that's going to kind of put some pressure on their tummy. You can also flip them over onto their bellies and lay them on their tummies with their knees to their chest. And that's it's almost like, this is so gross, but it's almost like the opposite of burping. So you're going to let the air come out the rear end by tilting their little bottoms upright so that the air can come. Again, gravity is going to let the air come out the top. So kind of laying them so that their little bottoms are more towards the top so that their little knees are kind of tucked under. That's his tail. Tucked under, and they're laying like on your lap or on the floor, and you're kind of patting them so that the air can rise to the top. That can help too. Or laying them up over your shoulder so there's a little pressure on their bellies can all sort of help alleviate the gas pain and pressure. So what about medicines? What about medications for gas? There is only one medicine that is approved for kids for gas, and that is simethicone, which comes in a brand name called Mylicon. Yep, Allie, fart your baby. That's exactly right. So Mylicon or simethicone drops are like they dissolve the gas inside the colon. Some people say they work. Some people say they don't, but they definitely don't hurt. They don't hurt the baby at all. There's nothing in them that can hurt. A lot of parents are going to ask about gripe water. That is a tough one. I could probably talk for 20 minutes just about my feelings on gripe water and other herbal supplements and holistic medicine and other things of that nature. In general, I think the thought is that unless it is studied in kids, we shouldn't give it to babies. So generally my answer is no, because I just don't know. I don't know if it's safe. No one's ever studied it in babies. And unless it's been studied in babies, I don't feel comfortable saying that it's okay for babies. And I'm certainly not going to ask you to volunteer your baby for the study to find out what happens when we give babies this much gripe water, and then what happens when we give babies this much gripe water, and then what happens if we give babies gripe water for 3 months versus 6 months versus 10 months, and so on and so forth, and what are the long-term effects of that? We have no idea, and it's probably fine, but nonetheless, I still think it's safer to say no to things like gripe water and agave syrup and kind of all the other sort of, chamomile teas and fennel roots and rice syrup and kind of all the other like homeopathic type things that are out there, and stick with what we know is safe and what we know probably works. And that's going to be like your soothing techniques like we talked about, and maybe some Mylicon every now and then if it seems to help with the kind of gassy, general, bubbly, gurgly, tummy, tooty stuff. So that's kind of just like your general gassy baby. And like I said, if your baby does have a lot of gas and seems to be, like I said, just very, very, very gassy, having lots and lots and lots of toots, it should resolve on its own, usually by the time they're about 6 to 8 weeks. And if it just seems like it's more than what you think it should be, then you should call. You should always call. Moving from that into more of like what would I consider to be like a colicky baby. Colic has like a very specific definition, and that is that they cry for a very specific amount of time at a very specific time of day. And it's usually like in the evening, and it's more than an hour, and they're crying for really no other good reason. So they cry and they cry and they scream, and you can't console them, and they're so upset, and there's no other reason for them to be crying. It's generally not crying all day, every day. It's not crying for some other reason. So they don't have a fever, they're not sick, they don't have a cold. They're otherwise perfectly fine, happy, content babies who are very specifically fussy during this time of day. And that's kind of the general definition of colic. It can bleed out during the daytime because there's certainly no hard and fast rules, but in general, that's sort of the definition of colic. What's interesting about the definition of colic is that there's no why in there. You know why? Because nobody knows why. Really, still, I even looked today because I was just super curious if there was any ongoing research on like the cause of colic, and there isn't, because I think nobody knows and nobody's gonna know. And I remember learning, like when I was in residency, which was a while ago, but that it's probably multifactorial, meaning that there's probably a lot of causes for colic. It's probably not just one thing. And so for each baby, it may be a different combination of causes. So what could it be? It could just be that they are overtired. It could be that they are overstimulated. It could be that they are on a formula that they're not tolerating. Perhaps it's something mom's eating and she's a breastfed baby. Maybe it's that mom's overtired and overstimulated and exhausted, and the baby's kind of feeding off of that, and it's causing a lot of stress and anxiety within the family, so the baby's feeding off of that. Maybe the baby's just bored and they're done with this business of being in the house and they're ready to get out. Maybe it's tummy upset, but quite honestly, most of the studies that are out there on colic are pretty clear that there does not seem to be anything like actually wrong with the baby's like colon, stomach, digestive tract, because they're all in general gaining weight well and growing fine, because if they're not, it's not colic. Colicky babies, they grow great, they are developing great, they're healthy babies in all other ways. There's really nothing like, quote, medically wrong with them. And that can be really frustrating for parents. It's certainly frustrating for us because I would like to be able to give you an answer, and I can't give you an answer, and all I can give you is reassurance. And that's probably not what you want. Probably what you want is an answer and a cure and make it stop, because it's very frustrating. And again, if you missed the beginning, I will tell you I've been through this twice with both of my kids. So what are some things that have been tried? In the past, lots of things have been tried. When I was a baby, they used to give us a medication. God, what was it called? And it just went right out of my head. But essentially, it was an opiate derivative, and it worked awesome. My mom said I went right to sleep, slept like a baby, because it had opioids in it. So the doctor actually prescribed it for my mom to give to me to make me stop screaming, and I did. I think that's pretty much why I'm so fabulous today, because I had opioids when I was a baby. I always tell her, imagine how smart I would have been if you hadn't given me opioids when I was a baby. I could have been brilliant. And so they, they kind of went through that phase. When my babies were babies, the thing that they thought it was reflux. And they put tons and tons and tons of kids on antacids like Zantac and Pepcid and Prilosec and Prevacid. And it may or may not have helped some kids, but for the most part, it probably really didn't make any difference at all. And it may in fact have done some harm to some kids. So I think most pediatricians nowadays really shy away from just dumping medications on babies with colic because it's not the answer. And it, like I said, it may in fact have done more harm than good. That is not to say that there aren't babies out there who have true reflux. There are. The big difference is that those babies aren't growing well. They aren't gaining weight well. They have a lot of other symptoms. It's not just that colicky, fussy, screaming their head off baby from 5 p.m. to midnight for no apparent reason. So they've tried treating it for acid reflux. The most recent trend was probiotics. And I think that's kind of where we are right now. Is a lot of studies are still ongoing with the use of probiotics. And if you aren't familiar with what those are the quote, good bacteria that live in our gut, like lactobacillus and some other ones. Yogurt has good bacteria in it. So instead of being an antibiotic, it's called a probiotic, and sometimes it's called a synbiotic. And so the thought is that maybe some of these babies are lacking in the amount of good bacteria in our gut, and that if we give them to them and replace them, that maybe that will make their colic resolve faster, and that if it's not harming them, then why not, right? Why would we not try it? And so I think, certainly recommend them sometimes. They are expensive. I know like a bottle of Gerber Soothe drops is about $30 and it lasts you about a month. And so, but I do have parents that certainly try it. Again, I don't know if it just would have gone away in a month anyway, but if it makes parents feel like they need to try it, I'm not opposed to trying it. I'm not sure the studies are really panning out. Dr. Goad, I just noticed that you were on here. So certainly if you know anything about colic and the probiotic studies, feel free to flash yourself up there. Maybe you wanted to stay stealth, and if you did, I'm sorry. But anyway, hi, how are you? So but probiotics I think are safe, and I can't imagine, unless, again, your baby is not a normal, healthy baby. I always preface all these talks by saying these are normal, healthy children that we're talking about, not preemies, not babies with other illnesses, not babies who have neurologic problems, because those kids, you should always talk to your pediatrician before you do anything, because they have very specific needs. And so this only pertains to normal, healthy kids. So those are some of the things that have been tried in the past. I think, having now kind of been down the road and watched the full cycle come around, I am back to that we've just got to wait it out, and it's terrible and nobody likes it. But I think that the quote unquote natural way is probably the most effective way, knowing that it does not seem to be that there's any really specific medical cause for colic. My personal opinion, and since all of you who are watching this are looking at my personal opinion, is that this is probably a combination of an immature gut, an immature brain, combined with over anxious and overstimulated parents, and that combination is what causes colicky babies. It is interesting in that it tends to be more common the older the parents are. And so it also tends to be more common in well-developed countries than it is in underdeveloped countries. I don't know what that means, but I do know that in well-developed countries, we are super high maintenance. We're kind of intense. And that in underdeveloped countries, they are just worried about survival, and they're not worried about being perfect. And we in our society, we are worried about perfection. Perfect mom, perfect baby, perfect spouse, perfect house. And so when you don't meet those standards, and having a screaming, crying baby is not perfect. And so, when you have that setup, and maybe you're a little depressed, that's not perfect either. So that setup, I think, certainly makes the baby sort of feel that like things are not quite right, and that they feed off of that. So I think that that's part of it too. So what are we going to do, right? How are we going to fix this? How are we going to make it better? And so these are, I'm just kind of run through what I think are some things you can try for your super colicky baby, your super stressed out self, and your super stressed out family. Number one, there's a book. It's called Happiest Baby on the Block. In that book, they refer to this time as the fourth trimester, meaning that, you, mommy, are still not back to normal, both mentally and physically. The baby is really still just a living, breathing fetus who cannot do anything except suck on your boob or bottle, and really is just so dependent on you. And so it's a tough time, right? So it's a good book / website / audible book, whatever, however you want to absorb your information. And you might want to check that out. So first things first would be, let's get the baby kind of calmed down. And one of the things they talk about in the book are the S's, and it's swishing. Nope, that's not it. It's swishing. No, swaddling. I got them. Swaddling, swaying, shushing, singing, swatting. I hope I got them right, but they sound really good. This is what I mean by that. So swaddling, and I talked about this in my sleep talk about how important it is that to swaddle babies in the first 6 to 8 weeks, because they just want to be all back in the uterus. And so we're going to swaddle this baby up nice and tight and make them feel all like they're super tight and comfy and warm and safe. And then you're going to sway with the baby. So, you're going to put the baby into however you feel comfortable holding them. And you're going to sing, or you're going to coo, or some sort of rhythmic shushing sound. They want that heartbeat sound, that and then the swatting. And that is going to sort of simulate the heartbeat that they're used to. So think like the last 9 months they've spent upside down in your belly with their little booties up against your heart. And that is where they want to go back to. So this is kind of what I recommend. One of the things that goes along with this is something called the colic hold. The colic hold looks like this, and this is where Scout is going to come in again. So come on, Scout. I'm going to stand up and show you. So this is the colic hold. You are going to take the baby. Here we go. And you're going to put your arm like this, putting the baby's head here, all right? And you're going to put your arm so that one side of the arm goes on this side, the other little arm is here. The two legs are on either side of your other, like of your hand. I hope I'm making sense. Essentially, the baby's belly is resting on your arm, and he's kind of upside down with his back against your belly. So he's sort of laying on his left-hand side with his arms and legs on either side of your arm, and you're sort of supporting him with your hand here and with your elbow here. So when you do that, it's easy to sway or swing, and then you have an easy access to their butt where you can pat, and then shush sort of rhythmically. So you're sort of the other nice thing about it is if you have other children, you've got this free hand that can do other things. But it's interesting when I do this in the room with babies is that they will begin to sort of relax. Their little arms and legs will begin to sort of stretch out and fall down, and they sort of just let go and they calm down. I held my babies like this for hours and hours and hours, and it definitely worked. So the colic hold with the swishing and the swaying, super, super helpful. The second thing that's really helpful is to stop trying to separate yourself from your baby. In our society, again, we somehow have decided that our babies need to be separate from us. They need to be in their own little sleepy thing, their swing and their car seat and all that while we're doing our thing. And I'm not talking about sleep, because we covered that and y'all know how I feel about it. Sleep is supposed to be separate and alone. But when you're on the computer, or when you're reading a book to your other kids, or when you're pushing them in a swing, or when you're whatever you're doing, most of us, our go-to is to just put them away. But instead, lean into it and just stuff that baby into a carrier, or one of those crossbody things that you can wrap the baby up really tight to your chest and just carry the baby around for a couple of weeks. It's okay. You're not going to spoil the baby. There's nothing wrong with that. Until about 8, 12, even 16 weeks, that's what they want to be. So it can help reduce colic symptoms if they're up on you, listening to your heart, listening to you talking. Daddy can do this too. So he can open his shirt up or put the baby inside his clothes and be right up on that heartbeat. It is going to make a huge difference if, instead of always trying to push the baby away and make them stop crying, putting them in their little swingy thing and all that stuff, is instead just bring them back to you and put them back on your body, and just get stuff done that way, and stop stressing so much about trying to get things done, because you can't right now. This isn't the time to do it. You got to just relax and know that this is temporary and it is going to get better, because they don't last like this forever. They get better. I promise. I absolutely promise that they get better. So you've got your happiest baby moves, which is the S's, the swaying and the singing and the swatting and the swaddling. And then there's the stop trying to separate yourself from your baby by putting them inside your little, whatever you call those things. They have a name and I can't think of what they are, but the little nest things that you can either strap onto you. And then my third thing that I love is to just go outside. Babies love to be outside. I don't know why, but they do. And it's relaxing for us. The smells, the sounds, even if it's raining, even if it's cold, wrap up in a big blanket, sit out under an awning and let them hear the sounds and the smells. And it does calm everybody down. And so even if it's the middle of the night, 11 o'clock at night, sit out there with them, and getting that crying to stop is going to make you feel better. It's going to make everybody else feel better. You're just buying yourself minutes of peace for a while, until you can get through to the next day, and then the next day, and then the next day, and then it's going to end. They will stop being this way eventually. My last sort of thing is to call for help. You are not alone. No matter what happens with this baby not being the way that you expected the baby to be, fussy and gassy and crying all the time and super high maintenance and clingy, you're not alone. There is always going to be somebody to help. I promise you, there are people out there who love to hold babies, and that baby, is not going to cry as much for somebody else. And in general, when it's not your own biological baby, your own, child that is yours, it's a lot easier to make it stop crying, because you don't have that sort of invested interest in it, that own sort of mom instinct towards it. So sometimes just walking away, calling up that neighbor, your best friend, your great aunt, saying, you know what, I need an hour. So can you just come on over, and she's going to scream, but you're going to come hold this kid while she screams, because I need like an hour to go to Target and not hear her, or go get my nails done, or go to my mom's and take a nap, or whatever. But just get away from the baby. And it's okay. You're not a bad mom. We all need to get away from our children. They're annoying. We love them, but they're annoying. And so don't feel like a failure if you've got to walk away from the baby for a while. And that includes dads. So, take that time for yourself, even if it's only been a week, and you need to get away. It is so important to take time for yourself. The house, the other kids, the dog, everything else can wait, because you've got to take care of yourself so you don't hurt yourself, so you don't hurt that baby, so you don't get so depressed that you can't recover. because it happens. It happens to more of us than we know, because these statistics are so underrepresented because many of us are afraid to talk about how bad we suffered with postpartum depression. And so I just think that it's important that moms know that there are people out there who can listen and can help. If you can't talk to your OB, talk to your pediatrician. We can get you help too. There are always resources for moms, colicky babies, or any baby for that matter. Okay, so I think that covers colicky babies. To me, again, I think it's, if I didn't talk about it, the other little tips are some heat on the belly. When we talked about sleep, I talked about using like a tube sock with some rice in it, heating that up and putting that on top of the baby's belly, or laying the baby like on top of the rice sock and patting the baby on top of that can help soothe that. If they like a bath, a warm bath can be really helpful to help soothe their tummies. Massage is really great. There are YouTube videos out there about baby massage and how to do it appropriately. That also brings up another really good point of something I do not recommend for colic, and that is chiropractic care. The American Academy of Pediatrics and most pediatricians agree that spinal manipulation is not appropriate in newborns ever under any circumstances. Now, many chiropractors will offer massage for babies. That is completely fine. I have no problem with massage for babies for colic. Gentle massage, some heat and that kind of stuff can be very soothing for both of you. And I fully support that. But under no circumstances should there be spinal manipulation in newborns or infants really under the age of 12 months, because it is extraordinarily dangerous. So do not do that for colic. What else? I think that is the big stuff. Some things that you should probably call us for that I don't think are colic would be lots and lots of vomiting. And I don't mean a little spit up. Spitting up to me is not forceful. Spitting up is small amounts, maybe the size of like a grapefruit or smaller. Spitting up is, a few times after every feed, but spitting up shouldn't be projectile. Spitting up shouldn't be like, the size of like a basketball on the ground. So that would be vomiting. And if they're vomiting frequently after feedings, then that's not colic. Fever is not colic. Diarrhea is not colic. How do you know if a baby has diarrhea? Well, if there's mucus in it, like stringy egg white looking stuff, lots of it. If it's foamy, if it's got blood in it, if they have little like dark red stuff, maybe it's blood, maybe it's not, you're not sure. Yeah, you should definitely call us. What else? I think that's the big stuff, really. This one's a little bit shorter because it's kind of a more specific topic. But I feel like it was one that I kind of wanted to get out there, and there's not, probably not a lot of questions that people have. Other things that people usually ask me about would be like, when do we switch formulas? In general, different formulas don't seem to make a huge difference if it's colic. Now, if it's a formula intolerance, then it might make a big difference. And that would be something I think we would need to talk about in an office visit, but I would not recommend just willy-nilly changing formulas here and there without talking to your doctor, because they might be able to specifically recommend one based on what your baby's specific symptoms are. So sometimes formula changes can help if it's not just colic. If there's more to the story, then formula changes can help. Does anybody have any other questions or anything else with regards to fussy babies that they want to know about? I am open to questions. So is Scout. Allie, why are you raising your hand? Do you think I'm going to take your kid for the night? Oh, Aaron. Hi, Aaron. My 4-month-old cries constantly in his car seat. Oh gosh, we get that question a lot. Oh, okay. Couple of things. Try to keep him as cool as you can. It does get super hot in the car seat. And so they might be getting a little toasty back there. Oh yeah, Whitney, that's what Aaron is saying too. The same thing, that their kids cry in the car all the time. The motion sickness is, it's rough. So a couple of things, keep them very cool. Keep the air on back there, even if it seems like, maybe it's cold outside. Don't let them get hot back there. Don't put their coats on in the car seat, which is a safety thing anyway. Instead, coats off, and then buckle them in, and then a blanket over them if they're chilly. But they get so hot anyway with the coats on underneath the buckles, and you're not supposed to, because it's supposed to be super snug to their bodies. Keep the windows covered with like the stuff that you can see through, but maybe they can't, because seeing that stuff going by backwards could really make you super nauseous. So trying to avoid that. Videos and watching TV in the car can make them super nauseous. So trying to avoid that. Lots of water. Very, 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 very hydrated. So they don't make sure they're kind of tanked up before they go, and then keeping them hydrated with some ice cold water on the ride. For the 4-month-old, that's not an option, but pretty soon it will be when they're 6 months. You can use those wristbands for nausea, and you can use them even in babies if you can find one that will fit the little ones. But those are totally safe for nauseous babies in the car. I mean, it is probably car sickness, and it is horrible. But keeping them cool, keeping them hydrated. Don't let them see outside. No videos in the car. No books in the car. And instead, like stuffed animals and little toys that they can play with to just keep them amused. And you will have to do a lot of singing to keep them distracted, a lot of songs and word games and stuff, so that they are not so focused on feeling sick to their stomach. So I hope that kind of helped answer your question. Anybody else have any questions? If not, I've enjoyed talking to you guys. Again, I'm Dr. Jean Wagner with A to Z Pediatrics, and this has been Tot Talks, talking about colic and fussy babies. Next time, I'm planning on doing some summer stuffs for the bigger kids, like poison ivy, mosquito bites, bug bites, ticks, scabies, sunburns, things like that. So join me in about 2 weeks, and I will see you guys then. Oh, and Scout says bye. Bye, guys. Thanks.